Good afternoon. I am Mark Lowry, and I serve as Assistant Director of the Office of Climate Change at the New York State Department of Environmental Conservation. On behalf of all of my colleagues who are working to develop the New York State Extreme Heat Action Plan, I welcome you to the second webinar in this 4-webinar series to support the state's planning for extreme heat. During the first webinar of this series, which was presented on April 27th, we learned from experts about the effects of extreme heat on the built environment across numerous scales, from buildings to transportation infrastructure. We also heard about interventions that are working now to moderate these impacts for individuals and communities. A recording of that April 27th webinar, as well as the presentation materials, the upcoming webinar schedule, and the other information related to extreme heat planning are available at DEC's Extreme Heat website, and we will place the link to that website in the chat window during the course of this webinar. The extreme heat planning process is the result of determined efforts by many dedicated state agency staff, all under the leadership of Dr. Leo Bockinger at DEC, Jennifer Singh Bach and Anna Brown at NYSERDA, Dr. Neil Muscatello at the Department of Health, and Peter Cicchetti at the Division of Homeland Security and Emergency Services. And I want to thank all of them, as well as the staff at the Cadmus Group, for their work on this effort. We have been working with the University of Buffalo to produce this webinar series, and I would be remiss in not acknowledging the work of Ms. Megan Holtan at UBuffalo School of Architecture and Planning, and Dr. Nicholas Rajkovich, who will also serve as today's moderator, in bringing together the outstanding group of speakers featured in this series. I also want to thank the staff from DEC's Division of Communication, Education, and Engagement for their assistance in bringing this series to you. Today's webinar is titled Extreme Heat, Health, and Policy, Strategies Across New York's Many Landscapes. Today's panel of 3 experts will explore the effects of extreme heat across New York's diverse geographies and communities, including urban heat islands and rural and suburban communities. They will also discuss the effects of extreme heat on workers and the ways extreme heat intersects with the housing, energy, and agricultural sectors. Our speakers will not only describe heat effects, but potential policies and solutions to the risk associated with increasing frequency, length, and severity of extreme heat events. After today, 2 webinars will remain in our series. On June 8th, speakers will showcase local solutions and partnerships to address extreme heat. And on June 22nd, we will present Preparing for Summer 2023, what individuals and local governments can do during the heat wave. It is now my pleasure to introduce today's moderator, Dr. Nicholas Rajkovich. Dr. Rajkovich is an associate professor in the School of Architecture and Planning at the University of Buffalo. His work at UB focuses on the intersection of climate change, energy efficiency, and community development. Nick is currently the Building Sector Co-Chair for the New York State Climate Impacts Assessment, examining how the built environment in the Northeast United States will need to adapt to climate change. He has also supported organizations like the American Institute of Architects and the U.S. Green Building Council as they incorporate resilience into their programs. He is a licensed architect, holds a doctorate in urban and regional planning from the University of Michigan, a Master of Architecture from the University of Oregon, and a Bachelor of Architecture from Cornell University. Nick, it's up to you now.
Thanks, Mark. Thank you for that great introduction. Welcome everybody this afternoon to the second webinar in the series of 4. I want to echo Mark's comments and thank all of the many state agency staff who are working on this Extreme Heat Action Plan, and for all of your attendance today here at for this second webinar. UB, as Mark mentioned, is supporting this effort, and we're really excited to share with you a great lineup for today, which will include Dr. Augusta Williams from the State University of New York, Upstate Medical University, Diana Hernandez from Columbia University's Mailman School of Public Health, and Dr. Debbie Aller from Cornell University. Our first speaker, though, today is Augusta Williams. She's an assistant professor at SUNY Upstate in the Department of Public Health and Preventive Medicine. She earned her doctorate and completed her postdoctoral training at Harvard University at the T.H. Chan School of Public Health and her Master of Public Health from Columbia University's Mailman School of Public Health, both in environmental health sciences. She has a BS in biology and atmospheric sciences from Hobart and William Smith's colleges. Her training and expertise is at the intersection of public health, atmospheric science, and climate change. She examines how hazardous heat impacts health outcomes. She was also awarded a 2020 United States Presidential Management Fellowship, which allowed her to spend over 2 years as a health scientist at the United States Department of Labor's Occupational Safety and Health Administration, working at the intersection of science translation into public policy on the agency's heat regulatory portfolio. We're all very excited to have Augusta here presenting this afternoon. I'll just say that at the end of her presentation, we will have 5 minutes available for questions. And if you do have questions for Dr. Williams or any of the speakers at the end of their individual presentations, again, clarifying questions only, please put those into the chat and I will try to read them to the speaker. But without further ado, I'd like to turn it over to Dr. Augusta Williams to talk about extreme heat, health, and policy across New York's many landscapes. So go ahead and take it away.
Thanks, Nick, and hi, everyone. Thank you so much for tuning in to this fantastic webinar series that the state is putting on, and I'm honored to be a part of it. And I'm really excited to kick off today's group of panelists and set the stage a bit on a few different topics that really cover this intersection of how heat impacts health, but also a few different touch points for policy relevant interventions and solutions that we can be thinking about in New York State to mitigate that health burden of heat across New York's many different landscapes. So next slide, please. So many of you are probably here today because you are aware that heat is hazardous to human health in some way. And we've known this for a long time, and heat is in fact year after year the leading cause of death of all weather-related events, which is often surprising given that it typically looks less scary visually than things like hurricanes, floods, lightning, tornadoes. But there's many decades of research that demonstrate these connections, where we find that as temperatures increase, so do the impacts on public health. And this graph here provides an example of how the risk of death in New York City increases as temperature increases. You know, we see in the red line that as those temperatures climb, there's, you know, this significant increase in the risk of death occurring. Most interestingly, though, I would like to call your attention to what is called the minimum mortality temperature. And this top kind of call out box points to that line where that's demonstrated. And this is really the optimum temperature, where above and below this temperature, we start to see that increase in mortality. The risk of death increases when we deviate from this minimum mortality temperature. And really wanted to share this to demonstrate that across New York, you know, this graph here is for New York City. In the bottom right showed a call out to the Syracuse graph, partially because that's where I'm currently located. But if you're interested, there's graphs available for other sections of the state as well. But really to show that temperatures do not have to be as extreme as people may typically think to start seeing health impacts due to heat. In New York City, we see that that temperature is, you know, in the low 20 degrees Celsius range, which equates to about 73.5 degrees Fahrenheit. In the Syracuse graph, it's even a few degrees lower, around 70 degrees Fahrenheit, and included some figures here to show that if we're looking out on Long Island or even across the other parts of Western, Central, Finger Lakes, and the capital region, you know, we're in that lower 70 degree Fahrenheit range. Of course, as it gets hotter than this, the risk is much greater, but wanted to start by really covering that ground of temperatures do not have to be, you know, in the 100s to elicit health impacts. Next slide, please. And mortality or death is really the most severe of all the health impacts that heat has found to be associated with. There's a myriad of others that we know that heat influences that are really critical to mitigate as well. So as temperatures rise, we see the exacerbation of cardiovascular, gastrointestinal, respiratory, and even kidney disease. We see things like advanced dehydration, which can have its own downstream health impacts. But we also see an increased burden on the health system as a whole. people are ending up in emergency rooms, admitted to the hospital in greater numbers, which takes a toll on those healthcare facilities and the providers and the resources available. But our sleep is also impaired during hot nights, which are also increasing. And because of that, there's a body of evidence to show that heat impairs our cognitive function, our ability to make good and rational decisions, how productive we may be, and can therefore end up resulting in things like traumatic injuries in the workplace, but also, other different effects for anyone who may need that cognitive, rational thinking element as, part of just their day-to-day life, which I think I would argue is probably pretty much everyone across the state. Next slide, please. And, anybody can be subject to heat stress and its related health outcomes, but there are some populations who are more vulnerable to these health impacts of heat. Athletes, lower income individuals, those working either outdoors or indoors without adequate climate control, people who may be experiencing shelter insecurity, people who may not speak the primary language in which they are living, so therefore are limited in what information they are able to adequately receive, people who may be socially isolated, animals are all at heightened risk. And then next slide, please, I believe. Then other groups, like the few I've highlighted here, like older adults, children, pregnant persons, people taking different medications, or even those who may have a pre-existing health condition or disability may also be more susceptible to the health impacts of heat due to, these populations may have a different ability to thermoregulate or adjust their bodies to hotter temperatures, which makes them more susceptible to these health impacts. Or alternatively, or perhaps in addition for some, they may not be able to perceive as adequately that they are hot. Some evidence has shown that for, as we age, or certain medications actually limit our ability to recognize that you're too hot until it may be too late to act. So that also is a factor that really plays into whether or not certain populations are more vulnerable, more susceptible to the health impacts of extreme heat. Next slide, please. And so all of that to set the stage, because as we think about the different parts of New York, we know that urban areas are often more vulnerable to heat. There's a long body of evidence to demonstrate that. But it's also critical to recognize that there may be other unique drivers of vulnerability in the many other landscapes of New York, like the state's many rural and suburban areas. So we'll talk about this a bit more throughout the rest of my presentation. Next slide, please. So urban areas are influenced by a number of factors. One of the biggest when it comes to heat is what's known as the urban heat island effect, which means that in cities, they're usually several to tens of degrees hotter than the surrounding rural and suburban areas due to, things like more non-reflective surfaces, fewer trees, the density of buildings and emissions and those types of factors that I believe were covered at least in part in the latest webinar, so won't go too much in depth into that. But these factors combined with perhaps poor housing conditions as a whole, where we have buildings that are often much closer together, made out of heat absorbing materials, perhaps with limited air conditioning access. But then we also have individual and neighborhood sociodemographic characteristics that also factor into disparities in heat vulnerability. This map here shows one of a number of heat vulnerability analyses done for New York City. And we can see in the darker oranges and reds, located primarily in Upper Manhattan, the Bronx, and then into parts of Brooklyn and Queens, we have places where there's a higher number of this vulnerability, where you have more of these factors co-located in one place, meaning that these areas should really be priority areas for heat mitigation because they have more of these vulnerability factors, and that could set them up to be, have a disproportionate number of these health impacts. So it's really critical for any urban area to assess what these factors might be in their location, where these different populations or environmental risk factors may be co-located, because that's really key in identifying priority areas for heat solutions. Next slide, please. In more rural areas, like much of the rest of the physical area of the state of New York, there may be kind of other factors contributing to this, especially because the urban heat island effect may not be increasing heat exposure directly as much as in urban areas. So about 7 to 13% of the state's population resides in non-metropolitan areas. And while this may seem like a small percentage, depending on how you're defining non-metropolitan areas, that equates to about 1.5 to 2.5 million people. And despite these areas being less studied compared to urban areas, they really have some unique areas of vulnerability that I think are really critical when preparing the state for a hotter future. So across these areas of New York, and this map here shows the entire state, again, another heat vulnerability analysis, again, highlighting as you move into those darker colors, you become more vulnerable. And in these areas, it may be driven by factors such as more limited access to healthcare resources and fewer healthcare providers. You have lower medium household incomes and higher rates of poverty. You have more people who don't have health insurance, which, both the access to health care and health insurance limits any type of preventative education people are getting on heat, but also, access to medical services when they may be being impacted by heat and those health outcomes. You also have populations that are generally on average older, so you have a higher median age in these areas. You also have more underlying health conditions, especially in New York. We have worse rates of cardiovascular and diabetic disease in these non-metropolitan and rural areas. And you also have significantly more socially isolated older adults. So all of these factors we know contribute to heat vulnerability, and in New York specifically have been found to be some of those drivers of why the rural, non-metropolitan parts of the state may also have some unique heat vulnerability factors when it comes to heat's impact on public health. Next slide, please. Across all of these different landscapes, air conditioning has really been a primary solution for worsening heat, either at home air conditioning or via cooling centers. And whether or not this is the most sustainable solution moving forward is not really what I'll focus on today, but it does have different considerations when you're talking about New York's different landscapes. We have a lot of evidence to show that air conditioning is a really critical protective factor in urban areas across the world, but including in the urban areas of New York State. But in rural residents across the country, they're less likely to have air conditioning at home. And in fact, more than 1 million rural households across the United States report being unable to use an air conditioner at all. So if that's part of the solution package that we're putting together, it's critical to think about the disparities in access there. And cooling centers have really become a great way to bridge some of those disparities and who has access to cool spaces when it's hot out and who doesn't, which is fantastic. But there's fewer cooling centers and other heat resources that are similar in rural areas. A recent study found that only 3% of the state's cooling centers were in rural areas, and they were on average about 18 miles away, which then brings forth issues related to transportation, and that may be something that's more limited in rural areas, but is a challenge kind of across different landscapes. But again, that context is really specific. You might have, if you're thinking about New York City in particular, you might have a shorter distance, but if it requires somebody taking 3 buses and a subway and then a long walk on a hot day, even though it's only quote, a few miles away, that can still be really burdensome and a huge barrier to actually access cooling centers on those hottest days. So again, comes back to that local context and figuring out what is really practical and feasible for the constituents in that local community. Next slide, please. And this map here really just reiterates this point. It shows kind of different groups, the distance to the nearest cooling centers in those regions, with the darkest colors indicating a further distance. So you can see in parts of Western New York, up into the North Country, the Adirondacks, parts of Long Island, and kind of some other scattered spots across the state, the distance to a cooling center can be, 10 to 50 miles away. So that can be a really important factor, that if that's part of the solution strategy for that part of the state, to really think about how to perhaps create more accessible cooling in these parts of the state that are currently being less served by this particular strategy. Next slide, please. And then switching gears a bit, just wanted to touch a little bit more in depth on another vulnerable population that I think, requires a specific call out here. Workers who are really an at-risk population. Again, both those who are working outdoors, which is about 23 to 40% of our working population, but also those working indoors who may not have access to adequate climate control. Think people who are working in manufacturing, warehousing, restaurants, bakeries, places that are not typically as well climate controlled and can get extremely hot. And while some of the same vulnerability factors and personal risk factors that we just discussed, kind of as they apply to the public, are also relevant here, there's also some additional factors that contribute to heat stress in occupational populations, like how much exertional work is someone having to do? How is work structured? Who is someone reporting to? How are they being trained? Whether or not that worker is acclimatized or used to working in the heat and has been able to gradually build up a tolerance to work in hot conditions. And also critical to think about if someone is working around a process or a piece of equipment that generates heat, that will influence their exposure as well. Next slide, please. And while there's many different studies out there on workers, this one I think is always a really important one to discuss to really show the relative risk of work-related, heat-related fatalities in the United States. People working outside, in particular, construction workers, landscapers, delivery workers, waste and sanitation workers, farmers, farm workers, many other groups, too many to list here in this moment, are having to work in increasingly hotter conditions. And, these individuals also disproportionately make up cases of workplace heat-related illnesses and fatalities. Compared to other industries, construction workers have been found to have 13 times the risk of heat-related deaths in this one study. And those working in agriculture, forestry, fishing, and hunting, which is, I don't know the numbers off the top of my head, but I know New York is a very much an agriculture state. So wanted to call that out. This group was found to have 35 times the risk compared to other industries of those heat-related fatalities at work. So just wanted to include that as we talk about who might be vulnerable and some of these important health impacts to consider. Next slide, please. And wanted to note again that across a lot of the occupational heat and health literature, it's becoming more evident that it doesn't have to be that hot or that extreme for the conditions to be hazardous. We begin to see occupational safety and health impacts when the heat index, which is a measure of temperature and humidity, you might be familiar with it as that feels like temperature that you see on many different weather apps on your phone. But when the heat index is, anywhere from 80 to 85 degrees Fahrenheit, which is not the most extreme conditions we see across New York, we start to see those health impacts, which is why I really think the work of the state and this extreme heat action planning group is so critical to continue to put these plans together to ensure that people across the state are protected from heat, since we know these health impacts are only increasing and happening at temperatures that are hot but are continuing to get hotter. Next slide, please. And so there's many, many different ways to address heat, but some of the potential policy-oriented levers I see as it relates to some of the topics I spoke about here this afternoon are really making sure we're equitably addressing and thinking about New York's many landscapes. It's a really interesting state because we have, some really major urban areas, lots of suburban areas, and then a lot of geographic area that is rural, non-metropolitan. And each of these places may have unique vulnerabilities, different needs, impacts, and strategies for intervention. And I think, this group is doing a great job of engaging all these different perspectives and regions of the state to have that input on what works for those local contexts. I think increasing equitable access to cooling resources and assistance in many different ways, and I believe Dr. Hernàndez will speak more about, that and energy insecurity. We also currently have bills in New York State that are before both the Assembly and the Senate that are looking at statewide regulations and outreach to reduce occupational heat-related injuries, illness, and fatalities, which I think is, a really a great next step and is following the lead of a lot of other states across the country who are starting and have considered these types of rules. But then I also think integrating heat resilience into existing programs and initiatives is really key. I'm currently located in central New York in Syracuse. We have, over the next decade, a huge construction happening on Interstate 81 and redesigning of different parts of the city. And, it makes me think, are there ways to integrate heat resilience into that project to protect the workers who will be working on it from heat, but also to factor in heat resilience as we redesigning communities and thinking of this community grid neighborhood situation that's currently the trajectory for this project. How can we build heat resilience into those plans to just make them more heat resilient neighborhoods to protect and promote public health? But I'm also from the North Country, where there's a lot of clean energy projects happening right now. Can we tie in heat resilience to, again, protect those workers who are, doing those things, but also making these efforts have some component that the communities and the neighborhoods they're working in are becoming more heat resilient as it relates to that project, using those solar panels for cooling or shading in some way. So I think adding things that are already in motion and factoring in heat resilience can really be a great way to protect health from heat. And then next and final slide, please. So this kind of just reiterates there are many different ways that we have a lot of evidence for protecting health and mitigating the health burden of hazardous heat, both in near and longer terms. I think the key here is really figuring out, based on the context, culture, community needs of these different landscapes of New York, what combination of these strategies might be the most effective. I have a feeling that a lot of these things will come into play. Some of these are already really, up and running across the state in different ways. And I think learning from each other, and again, this action group's doing a great job of engaging, folks on the ground, folks across the state in all these different regions to see what is working, what could be done, how can we stack these different solutions together to really make a big impact. And I think just adding into that, understanding these different contexts across the rural, suburban, urban landscapes will be really critical to ensure that we're protecting health in the most equitable way possible. So with that, thank you again for your time. And if there's any clarifying questions, Nick, feel free to send them my way.
Sure. Thank you very much for that great presentation. Really appreciate the breadth of things that you covered and going from the urban to the rural and bringing that perspective to the table. If folks have clarifying questions, they can drop them into the chat. We did get one question that came in talking specifically about El Nino as something that's impending, but I think maybe I will reserve it as a longer question for the end of the conversation here after everyone's had a chance to speak. But if anybody has a quick clarifying question that they'd like to ask, please drop it into the chat right now. Otherwise, I think we'll probably turn it over and go to our next panelist. I'm not seeing any come in, Augusta, so maybe we'll take on the longer El Nino question. You can think about that a little bit when put on your atmospheric science hat for a little bit
I
later.
know, switch gears
Yeah.
for a minute. But yeah, thanks. It sounds like a plan.
All right, thank you so much. So our next speaker is Dr. Diana Hernandez. She conducts research at the intersection of energy, equity, housing, health. A sociologist by training, her work focuses on environmental determinants of health and examines the impacts of policy and place-based interventions on the health and well-being of socially disadvantaged populations. Her foundational research on energy insecurity, which is defined as the inability to adequately meet household energy needs, has explored the multiple dimensions of this phenomenon, identifying sociodemographic disparities, adverse consequences, and promising interventions towards energy equity and justice. Much of her community-oriented research has been done in collaboration with community groups and government agencies throughout the country. Moreover, several of her projects have been conducted in her native South Bronx neighborhood, where she's led small-scale housing redevelopment projects. She's the co-director of the Energy Opportunity Lab at the Center for Global Energy Policy and deputy director of the Center for Environmental Health and Justice in Northern Manhattan. She also serves on New York City's Environmental Justice Advisory Board. In 2022, she was the recipient of the Public Health Catalyst Award from the Boston Congress of Public Health and a distinguished alumni honoree from Hunter College. And her first book, which I am excited to get a copy of, about energy insecurity in America, is due to be published in 2023. So please join me in welcoming Dr. Diana Hernandez. Thank you.
Excited to be here. Thank you so much, Nick, for the introduction. And really, it's an honor to follow Augusta. As I've seen her evolve professionally, it's always one of those moments where you feel extremely proud. And that was an excellent presentation. I will be more granular in the focus of my work today. And acknowledge that this is a project that is collaborative, and it was done with the New York City Department of Health and Mental Hygiene, with WEACT and the New York City Housing Authority back in 2020. So next slide, please. I also invite you to read our paper. It's open access and available. It was published earlier this year on extreme heat and COVID, looking at the COVID heat wave plan and intervention having to do with air conditioning distribution, an air conditioning distribution program, and I'll describe the results today. Some of the results you'll see are related and included in this paper, but I'll also take the opportunity to talk more broadly about other areas to focus on beyond the results that are already known and in the public domain. Next slide. So let's just kind of situate this work. There are many landscapes, and Dr. Williams really kind of provided such a rich description of the many landscapes in New York State. As a project that was based in New York City, I'll be talking a lot more about the local context here. And just to give some background, 350 exacerbated heat deaths are happening in New York City on an annual basis. And most of those people, all of those people who are dying from heat stroke, lacked an air conditioning unit in their home. Really kind of a demonstration of a very addressable gap and a way to prevent deaths in the city and elsewhere. Next slide, please. So this slide basically provides an image looking at New York City heat vulnerability, which Dr. Williams also presented in her work. But this also overlays COVID cases. And as with many kind of other issues, there's a layering effect where vulnerability is essentially concentrated spatially, geographically, and in terms of certain populations. And at the intersection of heat vulnerability and COVID-19 cases, we saw that very much emerging in some of the neighborhoods that are known to be be, kind of more vulnerable in various contexts. And on the other side is a map based on, it's based on kind of dated data, but it really does show that many of these same areas lack air conditioning units in their homes. And so the kind of lighter blue shaded areas are those homes where there's a lower AC penetration rate, meaning that in those areas, homes are less equipped. And that's about a third of all households in places like the Bronx and certain parts of Brooklyn lack air conditioning units. And this is information that if there's a plug in any way, it's really that we should be doing more work to better track access to air conditioning in homes. Next slide, please. But in 2020, many things were making headlines. Obviously, the COVID-19 pandemic was central, and being able to socially distance safely and at home actually made the home environment that much more important as a site of kind of public health and health protection. And as a result, there were many things that happened so quickly from a policy perspective during the pandemic. And this was a notable example around how city government essentially was able to very quickly act in anticipation of rising temperatures over the summer and create a really kind of robust network to distribute air conditioning units to households most at risk. And that included older adults and lower income adults. Also, it included not just the distribution of the air conditioning unit, where there was a target of and actually successfully installed units in over 70,000 homes over a 3 or 4 month period. But this also included a modest utility bill credit, something that we'll get into as I present the results. Next slide. And what you see here is, again, that heat vulnerability index with a layering of where the air conditioning units were actually installed. So you see with the kind of darker green dots that it was very well targeted in places with some of the highest needs. Again, a demonstration at a kind of a surface level of the opportunity to target interventions at community scale where the need is greatest, and to do so in a kind of a time sensitive way. As I'll describe shortly the results of the study, basically, we also targeted those same areas to be able to identify both participants and non-participants in the Get Cool program in order to be able to show the effects of having received an air conditioning unit as part of the program. Next slide. And I'd like to again acknowledge the partners on this project. Really, were it not for Katie Lane and Lauren Manley Smald and Carrie Olson, Sonal Jessel, so many different people that were involved. Darby Jack, my colleague at Columbia, we all really kind of came together pro bono to do this work. We thought it was important to be able to evaluate this really kind of important effort on the part of the city. And so we were assessing participants and their ability to stay home safely and use their air conditioning units in the summer of 2020. And we asked them kind of retrospectively to also report on the prior year. So we wanted to understand past and current barriers to heat protection. We randomly sampled 9,100 Get Cool participants and over 13,000 non-eligible participants. So they were still, these were slightly younger than the age cutoff for the program, but otherwise we're kind of very similar in their kind of socio-demographic profile. We offer both paper and online surveys, and I can tell you that the payment structure, the incentive structure for getting this work done through the university was quite a lift. But ultimately, next slide. We were able to include over 2,349 participants, over 1,400 of them participants in the Get Cool program, and just over 900 non-participants, so those without an air conditioning unit. Our response rate was relatively low, but that's also very common for this kind of survey type. And respondents in both groups, given the kind of eligibility criteria, were more likely to be people of color, so Black and Hispanic or Latinx, older, and also low income. Next slide. So when we asked participants, where did you go to get cool during the hot weather? We asked them about the summer of 2020 and also the summer of 2019. And as you see in the blue bar, the Get Cool participants actually increased the likelihood of staying home in that time frame by 19%. And they decreased other ways of keeping cool, like going outside, visiting a neighbor, or going to a cooling center. That was also the pattern of decreasing kind of these external cooling sources was also true for non-participants, but very far fewer of them were able to actually stay home, or you didn't see this kind of big jump in the households compared to the Get Cool participants, really suggesting that with an air conditioning unit, people were able to stay home to access cooling. Next slide. And when we looked at the adjusted odds of staying home between 2020 and 2019, Get Cool participants were much more likely to stay home in 2020 compared to 2019, adjusting for age, race, ethnicity, and more participants said that their home was comfortable. 7% of participants and 9% of non-participants reported going to a cooling center in 2020. And so as we kind of recognize that cooling centers are an opportunity for people to access cooling, we also kind of need to recognize how underutilized that resource is, and that there is, some benefit in allowing people to have access to cooling at home for various reasons, some including that, it's a 24-hour component, and that there's sometimes more convenience to being able to achieve comfort at home. Next slide. When we asked whether or not hot weather was making household members feel sick or worsen health conditions, we found that more non-participants, so those that didn't receive an air conditioning unit, reported or responded in the affirmative to that question compared to participants in the program, meaning that that non-participants, those that didn't have access to an air conditioning unit, were reporting feeling sick at home more often. Next slide. And this is true when we adjusted when we kind of adjusted for race, ethnicity, and other factors in that experience, so that participants in the Get Cool program were much less likely to feel sick. Next slide. We also asked about barriers to getting an AC, which is a really fundamental question. And here we actually see kind of more parity in some areas than others. So there was this kind of ubiquitous concern around affordability and not being able to actually afford the AC unit. But we also saw that there were concerns around increased electricity costs. And that was even true among, and especially among the participants in the program. And it was actually one of the reasons why, even though they had the unit at home, some actually opted not to use it because of the concerns around the operating costs. There were also concerns around proper installation, installation fees, also surcharges that the landlord, would assess, and applying for cooling assistance. And the cooling assistance pieces, many of these factors actually were more so reported by non-participants. Next slide. And so that really points to a larger issue. We can think about this problem as technical, and having a technical fix around providing a window AC. But we also have to be thinking about it within a structure that is much bigger than just a technical or physical apparatus. Next slide. So my work has really kind of demonstrated the connections between energy and health and poverty with this construct of energy insecurity, which is defined as the inability to adequately meet basic household energy needs. And there are three dimensions to this. There's an economic dimension, which is the high bills and low income. There's a physical dimension to it, which has everything to do with the kind of energy infrastructure in a home, and also the coping component. So those adaptive strategies that households are deploying in order to manage these economic and physical burdens. There are also acute and chronic forms of energy insecurity, power outages, for instance, or appliance breakdowns, fuel shortages being an example of an acute form of energy insecurity, which affects, kind of members of the population at large, even as people are able to contend with those situations differently depending on the resources that they have on hand. And then there are chronic aspects to energy insecurity, and that really is reflective of these ongoing financial hardships, lacking appliances, limited access to clean energy, and ultimately where the chronic and the acute converge has to do with disconnections. So if you experience energy insecurity on a chronic enough basis, there may come a time when you also kind of are up against the threat or experience of a disconnection as a result of non-payment. And oftentimes those disconnections are short in duration in terms of timing, but that they're still very impactful for households, especially those facing disconnections on an ongoing basis. Next slide. I think I'm seeing something in the chat by Nick. I may have to cut short. All right, so I'm just going to say that basically, our results also kind of indicate that there were households that were experiencing trouble paying their electric and gas bills. They'd received a disconnection notice, and that their energy services were cut off. Next slide. And we see that kind of happening more so among certain households, including low-income households and Black households in New York City. Next slide. And when we look at the connections to health, we see that those having kind of certain health conditions like asthma or needing, relying on electric medical equipment, or having heat-related illness at home were more likely to be energy insecure. Next slide. And that the result of energy insecurity, kind of impacted sleep quality, stress, the exacerbation of existing health conditions like asthma or hypertension, a willingness to invite people over, decisions about food purchases, and decisions about medical purchases. So really reflective of the kind of trade-offs that households are making. And this is the last slide. Next slide, please. In thinking about the implications of this work, we can kind of separate it into two buckets. The Get Cool results really point to promoting heat education programs, providing cooling guidelines, similar to the city's guidelines around heating, implementing outdoor heat mitigation strategies like tree canopy, and ensuring that all households in New York City have the ability to cool at or at least close to home. But like looking at it a little bit more broadly, you want to increase access to home energy assistance programs, expand cooling assistance to the summer months, and also include bill assistance within that. And we can talk more broadly about the limitations of the home energy assistance program in New York State in particular in the Q&A. I think we want to be screening for energy insecurity in clinical, social service and public health agencies, and thinking about pathways to affordable bills and seasonal protections against shutoffs in the summer months. And with that, I'll pass it over to the next speaker. Thank you.
And sorry about that, Dan. I was actually responding to someone who had asked a question about where they could find, they had to drop off the presentation, but where they could find it in the future. And so Mark Lowry just posted the website where this video will be recorded and kind of housed in the long term. But that was a fantastic presentation. Thank you.
Thank you.
So just one question, and this is a clarifying question I have. And again, if folks have ones that they want to put in the chat, please do so. But both you and Augusta talked about sleep quality and about that being a concern. Can you talk a little bit about the link between sleep quality and overall health?
So basically, we think about the pillars of health often as, kind of what you eat, how you move your body, but also sleep is an important pillar of health. And there's the kind of mental health component and the physical health component. And in the work that I've done on energy insecurity in particular, what we found is that energy insecurity affects sleep in two ways. So some of it has to do with the thermal conditions that interrupt sleep, because if it's too hot, for instance, or if it's too cold, there are these kind of ideal temperature, like indoor temperature settings for sleep. You want it to be cool, you want it to be dark, but not too cold and not too hot, obviously. But also worry and chronic stress can also keep people up at night. And that is a manifestation of, like all of the economic concerns oftentimes associated with trying to figure out, well, how do you avoid disconnection? How do you think about how you're going to pay that bill, et cetera? And that really affects sleep quality. Those kind of, for people that have chronic health conditions, it doesn't necessarily help. It can exacerbate existing adverse health conditions, but it can also introduce them as a result of disrupting the circadian rhythm that is necessary for people to, basically have their health anchored in proper rest and good sleep.
Thanks. No, I mean, I think it's becoming increasingly important. And as you called out, that this is not just a technical issue, that this goes into the social and to the medical. And so sleep definitely sounds like something that crosses across all of those categories.
Yeah, I always like to say, sorry, that sleep and mental health are the most proximal health outcomes of this phenomenon. Sometimes you will see the kind of chronic health and other manifestations of it kind of in the longer term. But in the short term, for sure, those are kind of areas that are easy to measure, but they're also kind of much more evident in the more proximal sense.
Sure. And one clarification question that did come in on the chat was they were wondering what the source of the air conditioning penetration data was, and if it was available outside of New York City.
So that's available through the New York City Community Health Profiles. Those are done every 3 years or so. And I'm happy to share that in the chat. And I don't know that, I know Rex has a measure, but that survey is also done every 4 to 5 years. So we don't really have great annual data on air conditioning access.
Thank you very much. And Rex, for folks on the calls, the residential energy consumption survey. So
I'll put links in the chat to both.
thank you very much.
Thank you.
So our next speaker is Dr. Debbie Aller, and she's an extension associate at Cornell University and program coordinator for the New York Soil Health Initiative. She conducts applied research and coordinates extension activities to assist farmers in adopting more sustainable soil management practices. She also serves on the board of directors for the United States Biochar Initiative and is the lead author of the agriculture chapter for the upcoming New York State Climate Impacts Assessment. She earned her Master of Science in Environmental Science and International Development from the University of Edinburgh and PhD in Soil Science from Iowa State University. So, Dr. Aller, turn it over to you.
Thank you so much, Nick, and thank you to everyone for the invitation to be a part of this really great discussion today. I feel like I'm learning a lot myself, listening to Augusta and Diana, so it's really a great honor to be here today, and I really hope I can hone in on some of the points that Augusta actually commented on related to agriculture across New York State. So that's going to be the focus of my presentation today, and a lot of the work, which I'm just going to be touching upon, is going to be published later this year as part of the New York State Climate Assessment Report, which is the updated version of the 2011 Climate Report, which Nick is a part of the Buildings chapter. And this is really a collaborative effort of experts across New York State. So as Nick mentioned, I'm a soil scientist by training, but a lot of my work at this point is focused on climate resiliency within agriculture and thinking about climate smart agriculture, kind of the integration of mitigation, adaptation, and kind of sustainable productivity on farms across New York State and beyond. And so you can see in this opening slide I have here, just some pictures of different agriculture production across New York State. Next slide, please. So New York is very much an agricultural state. Many people don't think about it like that because when you hear New York, right, many people think of New York City or a lot of the urban centers. But there are more than 33,000 farms across New York State, and these range from the east end of Long Island all the way up to Erie County, up to Clinton County in the North Country, and everywhere in between. They cover roughly 23% of the land area of New York State and contribute billions of dollars to the economy of the state. And as Augusta mentioned, agriculture is a very vulnerable sector when it comes to the impacts of climate change, including the impacts of extreme heat and heat stress. Heat stress affects everything from the farm employees, which are the farmers and farm workers, anyone that's outside, the livestock, as well as many of the crops grown across New York State. And it is really the combination of both heat and the temperature, as well as humidity, partly the moisture that's in the air, that really is of concern to agriculture across the state. And these cause greater stress within livestock, reduce yields to crops, and as Augusta and Diana mentioned, may cause heat illness and death to agricultural workers. Next slide, please. Before I get to focusing on those three areas, I really want to point to or highlight some of these aspects related to urban agriculture, because urban agriculture is very much a growing component of agriculture within New York State. And on the slide here, I'm just highlighting a farm in New York City. And there are actually over 60 farms, urban ag farms in New York City. And this doesn't include community gardens or green spaces. And so Zoe Zoe Hampstead in the webinar last month really talked about the urban heat island effect, which Augusta mentioned earlier in the webinar today. And there's an enormous body of literature that shows that green spaces and urban agricultural spaces have a tremendous cooling effect on cities. The figure on the top right of the slide really highlights, you're using that orange line, as you can see temperature increases over buildings and urban residential spaces, and it decreases when you go to parks, farmlands, and more rural areas. So it's these green spaces and green roofs or urban farms that have a substantial cooling effect and really can help decrease temperature during extreme weather events. So agriculture in these urban spaces is particularly vulnerable to heat stress, not just because of these elevated temperatures in some of the figures that both Diana and Augusta showed, but this causes higher evapotranspiration rates in crops, which can lead to things like requiring more water to be used. And so there's all these kind of cascading and down and compounding impacts associated with increased temperature in urban areas and the impacts they have on crop production. So at the same time that the impacts are exacerbated to urban agriculture in these spaces and to crops, urban agriculture is also important. And when we think about it from a policy perspective, they play an important role in kind of adaptive planning in the future because they can help mitigate or alleviate some of these urban heat island effects. So policymakers and others need to think about how can we integrate not just green spaces, but urban farms into these areas. And so I'm using the example of New York City, but there are urban farms across the state in Albany, Syracuse, Buffalo, and elsewhere. Next slide, please. So for the rest of my presentation today, I'm just going to highlight some of the impacts already being observed and the adaptation strategies that folks are implementing, both to people, plants, and animals across New York State. So next slide, please. So what I mean by farm employees, and here I'm highlighting impacts, these are both farmers and farm workers. So this is kind of a phrase that encompasses both. And all these people who work in agriculture, they are vulnerable to the impacts of heat stress, as the previous speakers mentioned. And it is both the number of heat waves and the duration of these heat waves that have increased over the last 50 years and beyond. And I want to emphasize, which was something that Diana just mentioned previously, is this idea of mental health, that it's not just the physical impacts that extreme heat has to outdoor workers and farm workers in particular, but it's the mental health impacts. So there's the reduced capacity for physical activities, and these are things like weeding, spraying pesticides, which are needed in agriculture to produce all the foods that we eat, scouting for insects and pests, which is a very important component of an integrated pest management program in agriculture, as well as the planting and harvesting. So those are kind of the physical impacts. And related to that, one component or significant effect of climate change connected to this impacts of heat, extreme heat, are the fact that climate change is shortening the windows that farmers can plant and harvest. This might be due to heavy precipitation events and not being able to get into the field, or having unexpected weather, or dry spells, things like this variability we're seeing with climate change, because farmers rely on the weather. So farm workers can really only be out in the fields potentially for a short period of time. And it requires them to be there, be out in the sun during critical times. Otherwise, crops won't get harvested, crops won't get planted, and farms are businesses at the end of the day, and they need to produce a product. So it's a balance. And it's obviously very important from a health and safety standpoint. And the other point related to that is that mental health component, that extreme heat can negatively affect the psychological health and safety, obviously the socioeconomic well-being of farm workers. And I think many people are aware that a lot of farm workers are migrant workers, or they're not citizens of the US, and there are other issues around farm worker protection rights that have to be factored into this as well. And with other thinking about weather events as well, is this might mean that there are longer periods where workers may need to be in the field when there's adequate temperatures or adequate weather for planting and harvesting and things like that. And then other periods where they may need to rest, they may need to shift when they are in the field because it is too hot. As Augusta highlighted, and I have a slightly different figure, I think, but there was from the Center for Disease Control a number of years ago that generally farm workers are 20 times more likely to die from heat-related causes than any other workers across the US. Next slide, please. When it comes to adaptation for farm employees, and I think generally all outdoor workers, I've listed the first 4 bullet points on the slide there of thinking about what are some of the cooling devices, cooling mechanisms that can be done. Seeking shade where possible, resting during the hottest parts of the day, maybe taking those as your lunch breaks, making sure workers have access to enough water and are able to cool down their bodies. And as I mentioned previously, being able to shift their working hours to avoid the hottest part of the day, and wearing clothing. One of the things that makes them vulnerable to heat as well is that often farm workers and farmers are wearing long sleeves, long pants to protect themselves from the sun. But making sure these clothes are thin and breathable is really important. So clothing is critical when it comes to that. The OSHA, or Occupational Safety and Health Administration, provides some technical or a lot of technical information about workplace hazards and controls, which I think many folks here are aware of. They do have some new standards, and I think it was passed in 2021 around heat stress and protecting employees from heat-related hazards and the industry injuries and illnesses related to that. So there are some fact sheets and many other materials available on their website around this. Also, the New York Center for Agricultural Medicine and Health also offers a lot of resources and trainings for farmers and farm workers related to heat and cold illnesses and injuries as well. And there's a link at the bottom of the slide to that. So from thinking about a policy perspective, programs and policies need to support farm workers and take their perspective into consideration. There's a need for training and other program development and enforcement of certain standards to protect farm workers when it comes to extreme heat. Next slide, please. So I'm going to focus when it comes to the crop side of things just on vegetables. This is a way just to get the message across, but obviously you can think about this for other crops out there, field crops, corn, soybeans, and others, but I think vegetables are a really great example. So when it comes to heat stress and the impacts on vegetable production across New York State, it's the rise in both soil and air temperature that's beyond a threshold level, which can cause permanent harm to both growth and development of plants. And this ultimately can affect crop yields. So I've provided some images here of what some damage from heat stress or extreme heat might look like in a variety of crops. And many crops are sensitive to heat stress, but this does vary based on the duration of that heat stress, the crop type, and the temperature. But many crops, vegetables included, they require some type of cooling period at night. So without a decrease in temperatures at night, we can see the impacts of heat stress greater within vegetable production. So something like discoloration, uneven bead side, and something like broccoli, burned leaves, and it exacerbates pathogens and makes plants more susceptible to plant disease, and it can wipe out a crop. So I think what's important here and the ultimate end result is that this reduces yields and really makes crops unmarketable for farmers across the state. And farmers really need to be able to market their product to make money and stay in business. Because when people see a cauliflower like this, they're less willing, or they will not purchase that product. So this will not make it to market and will be lost income to farmers. Next slide, please. So there are many opportunities for farmers in general, growing various crops, adaptation strategies that they can implement. This might be easier for some crops compared to others, like field crops that rely on irrigation, and larger producers might not be able to implement some of these adaptation strategies, but I'm just presenting some of them here that are possibilities depending on scale and crop produced. Things like changing up irrigation methods, switching to micro or subsurface variable rate irrigation methods. This helps conserve water. In the picture on the top left, you might also be able to see that there's some residue or mulch on the surface there that helps cool the temperature of the surface and potentially reduce the evapotranspiration or loss of water from that crop and help conserve it and cool the surface. A lot of growers are shifting to controlled environment agriculture. Can think of this like greenhouse production. In places in urban centers, you might see this as container production or things like this. So this helps potentially serve as protected production for crops related to the impacts of climate change, not just temperature as well. Other things are shifting planting rates, growing different crops, because we are seeing kind of a change in the planting zones of various crops. There are going to be new crops that are going to be grown in certain parts of the state that were never able to be grown there before, and investing generally in other sustainable management practices on farms, their various strategies. And the last thing I want to highlight is farmers have the ability potentially to switch to more heat tolerant varieties. There's a lot of plant breeding and genetics that takes place behind what varieties a farmer plants in the field. And so there's a lot of work ongoing in creating heat tolerant varieties. Next slide, please. The last area I want to touch upon is livestock. So dairy is within the top 5 nationally, or dairy production in New York State is in the top 5, behind, I think California is the biggest dairy producer nationally, but New York State ranks really high up there. We are a large dairy state, particularly in the upstate area of New York, central New York, western New York, in the North Country. And so livestock, I'm going to say in general, includes the dairy production. It also includes beef cattle, sheep, goats, poultry, swine, horses, anything like that. And heat stress in livestock occurs when the animals generate and absorb more heat than they can expel over a period of time. And this is through increased respiration and sweating, or through supplemental cooling. So they just essentially, just like humans, cannot cool themselves, which is important. And I think basically livestock have an optimum comfort temperature just like humans do. And as we're seeing the number of days increase to extreme temperatures, animals are not able to cool themselves. So you can see in the figure there, the frequency of heat stress is a number of different locations across the Northeast are increasing or have increased and are predicted to increase further by the end of the century. And so I'm not going to go into details here, but there are both short and long-term impacts related to heat stress, impacts on livestock. But ultimately, this can lead to reduced reproduction, reduced immune function, and increases in infection, reduced quality of milk. And when we think of reduced quality of a product, it once again can impact the price of the product, and lower the quality, and once again impact the marketability of that product by farmers to the public. Next slide, please. So some of the adaptation opportunities around livestock, which are being explored in various parts of the state, and to whatever extent possible, farmers are able to adapt, because financially some of these are more expensive than others, but increasing ventilation within barns. A lot of agriculture is not, or dairy production, it's not in pasture, but it is in buildings. And so increasing barn ventilation, implementing misting systems, cooling beds, anything to help reduce the internal temperature of cows can really help with their productivity over time. Integrating more kind of agroforestry practices, or silvopasture is becoming more common across the state. So growing trees that can help provide shade to animals in open fields is becoming of much greater interest to folks. Adjusting feed is another important thing, and making sure that animals have adequate water are very important. There are also specific breeds out there that have a higher heat tolerance than others, so farmers can switch, if possible, to some of these more heat tolerant breeds. And the last thing, which is a very hot topic across New York State right now, but this idea of agrivoltaics or putting solar onto farmland. There's a lot of interest in the North Country, Central New York, Western New York. But are there ways to integrate livestock into basically agriculture with solar farming and integrate livestock into these systems that can help benefit the animals and keep some of this land within agriculture while helping the state meet some of its energy goals? There's a lot going on in that area right now. Next slide, please. So I kind of want to wrap up with just some resources and information. On the left there's a great program here at Cornell called the Climate Smart Farming Initiative. And this is a group of experts that are really coming from different angles to think about how can we address different impacts of climate change on agriculture across the state. There's a resource page that provides decision support tools for growers, has extension publications, provides education and outreach information to folks on different topics around climate change, including heat impacts to crops, and thinking about what changes can farmers make within their production to help reduce the severity of climate change on their farm and keep them as viable operations. The passage of the New York State Soil Health and Climate Resiliency Act in 2021 by the state Senate was a real momentous act. It really helped put climate change and soil health at the forefront of the conversation and thinking about it as an adaptation strategy. So there are some policy initiatives taking place, similar to what Augusta mentioned in her presentation, that really are connecting agriculture with climate adaptation and mitigation by farmers. Last thing on the right there that I want to mention, are the impacts in this New York State Climate Impacts Assessment, which I mentioned previously, which will be published in September, which is really going to provide in detail some of the things I touched upon, some of the topics I touched upon today. And the last thing I do want to mention is that there's been, from a policy perspective and programs, a boost in funding support farmers across New York State to help in the mitigation and adaptation of climate change, including some of these impacts related to heat stress. These are coming from the New York State Department of Ag and Markets at the state level, and some federal initiatives as well, thinking about the billions of dollars that went to these climate smart commodity grants across the nation. And some of that money is coming to New York State, and that will help farmers in New York State adapt to climate change. So policy efforts need to continue and help develop the resources and tools to assist farmers across New York State in decision making. So next slide, please. And I'll just say thank you very much. I really appreciate the opportunity to share some of the agriculture perspective with you all today. And I'd be happy to answer any clarifying questions.
Thank you. That was a great presentation. One question that came in, and again, folks can send in questions that they have into the chat for clarifying questions for Dr. Aller. But one question that came in was related to the timing of when heat occurs. So for example, in the maple industry, if they have very warm temperatures that happen in the early part of the spring, that I guess can damage or kind of destroy the harvest. Are there concerns about the changes in the heat patterns that we're seeing in New York State and how that relates to the ag industry?
Yeah, that's a really excellent question. And the short answer to that is absolutely yes. There'll be a focus within this climate assessment report on maple production in New York State. Unfortunately, some of the evidence, and particularly that's come out of Vermont as well, predicts that by the end of the century, a lot of maple production will no longer be occurring in New York State, just because maple production requires these kind of freeze-thaw cycles And the warming winters are really affecting the ability of sap to flow within maple production. So warming temperatures overall, not just these extreme heats, but generally warmer winters, which are happening across the state, are really affecting maple production. And maple production is going to continue to shift north by the end of the century.
Great, thank you. It's not great news for people who love the maple weekends in March, but I guess to be expected with a warming climate. I don't see any other clarifying questions coming into the chat, but I do want to encourage Augusta and Diana perhaps to join us and turn on their videos. And Craig, I don't know if you can maybe turn off the slides just so we can move it to more of a Q&A and question period.
Sure.
Thank you. So Augusta, I warned you before that the first question might be coming your way here related to El Nino. So one of the questions that came in on the chat was that the World Meteorological Organization said yesterday that there's a 98% likelihood that at least one of the next 5 years, and probably the entire 5-year period as a whole, will be the warmest on record because of El Nino changing. So how do you see the El Nino Southern Oscillation neutral patterns in New York changing with El Nino? And do we have any short-term actions that we can be taking in the next few months to year to address vulnerable populations in urban and rural locations? And does El Nino add any urgencies to our preparations?
Yeah, happy to give a little bit of context about this. So El Nino Southern Oscillation is a recurring climate pattern. In the El Nino phase, we end up seeing significantly warmer temperatures off the equatorial Pacific Ocean, so off the coast of South America. And that becomes important because our oceans and our atmosphere are all very fluid, they're all connected. So whenever we go into these extreme cycles like El Nino, you end up seeing changes in temperature and precipitation in different ways, really globally, all across the world. And I am by no means a weather forecaster or an El Nino expert, so would definitely encourage folks to go check out, the National Oceanic and Atmospheric Administration, or even within New York State, Columbia's International Research Institute for Climate and Health is always doing. They have a lot of expertise on this topic, including how it results in local impacts, including health impacts, for some of those specifics and local information. But it does appear that right now we're in an El Nino watch as of earlier this week, meaning those Pacific Ocean temperatures are warming, and this has been shown to result in drier and warmer conditions to some extent in the Northeast and the Great Lakes region of the US, depending on when El Nino might happen. So if we're thinking about New York, I think, it's important to know those effects. Different regions of the world could see drier conditions, warmer conditions, as well, perhaps even to a larger extent if we're thinking globally. But also important to know that this information is typically factored into things like our seasonal and subseasonal forecasts that we get from the Weather Service and other organizations like that. So right now, kind of while the other panelists were giving their great talks, pulled up the latest seasonal forecast, and it does show, above average temperatures across the East Coast for the next few months. So I think is really critical to include those experts in these conversations as well, to think about those local impacts. But I think regardless of what might be driving it, because there's many other types of teleconnections and climate patterns happening as well that can sometimes result in warmer than average temperatures. It's really critical for groups like this to be acting now, to again be more preventative, get these plans in place sooner rather than later, and perhaps additional reasoning for all the great work that's already happening across the state to be brought to the forefront at times like right now, before we're really into the hottest parts of the summer, so that communities and people on the ground who are doing this work and providing different interventions can be working on those and getting those things into place over the next few months. But then that, of course, applies as well to the next few years. The last few years have been some of the hottest on record, and I think if El Nino will continue to exacerbate that potentially is good to know, but I think just raises the urgency of all the work that everyone here on this call is doing.
Thanks. That's a great answer, and I definitely learned something. I'm a little bit scared now to think about where El Nino could go in terms of having these higher temperatures. You know, hotter than we've kind of seen in the past year, in the past couple of years, which have already been, I think, unseasonably warm, at least in Western New York. One of the things I really have appreciated about being on this webinar today is that I think we've mentioned the Bronx and Clinton County and Erie County, and we're talking about a lot of different landscapes across New York State. But what are some ideas perhaps the three of you have for increasing collaboration, you know, among our different fields that are represented today, but also perhaps to bridge some of these geographic considerations? Because I think one of the things that Dr. Aller's presentation brought home for me, right, is we all eat food, you know, and so we're all tied, you know, in urban and rural landscapes together. Are there ways, you know, beyond this webinar today that you could see us collaborating or working together to advance and address these issues? I'm not going to point it at any one person because that was a tough question that came in. So
I'll just start by saying that I am a Cornellian, and the Cornell Cooperative Extension really is like in every single county in the state. And I was telling Dr. Aller when we did a preparatory call that were it not for the Cornell Cooperative Extension, when I was a graduate student at Cornell, I applied for and was eligible for energy assistance. And the educational components at CCE and so many other things that are like so many of the other programs and services that are available are so critical. And so I feel like it's a really important infrastructure. And I just wanted to kind of lift that up as a potential for thinking about synergies, but also like localized approaches. So one of the things that I've been doing recently is having interviews with folks around the state in New York and California and in Alabama, and kind of thinking about the regulatory components of energy and, you know, what are the kind of clean energy opportunities, especially for low income and communities of color. And it's really obvious that like with NYSERDA's, for instance, clean energy hubs, the focus is regional and the focus is really about connecting folks that have things in common. And while I think it's really important to be thinking statewide about some of these issues, I do think that even having smaller connections at more regional scales can be critical. So that's just kind of a way to start the conversation, invite, you know, definitely the opportunities for thinking about metrics across, you know, some of these geographic boundaries, but also inviting the possibilities and the opportunities for thinking also at even smaller scales. Not always the right kind of answer when we're trying to lift up bigger collaborations, but also I think sometimes in terms of getting the work done, there's some value there.
Yeah, I've just kind of, I guess, add on a little bit to what Dr. Hernandez said, and I think it's a great question, Nick. And I think really to start, it has to be awareness and education around many of these topics, and making sure that we're bringing all the stakeholders at all different levels, from the community level to the state level, to the table, in thinking about policies and planning moving forward. It really needs to bring in all opinions and people from urban to rural areas. And recognizing that the interests of those groups and the diverse players across the state may vary, but how can we start to think about and tease apart all those different interests and motivations and concerns of different populations? And as I think about in working in extension and working with farmers, I really realized the language we use in communicating some of these topics is really, really important. And that type of language is going to vary among different populations across the state. And even a term like climate change we might not be able to use climate change in certain areas of the state and within certain communities. We might have to think about it as weather or extreme weather. And so I think just starting to make people aware of this work across all the diversity of New York State is really going to be the first step. But then being able to bring different opinions in is really important.
And I think the only added thing I have really relates to what was just shared, which I think are all great points, but I think really knowing your audience, who are you trying to work with, what community are you trying to integrate solutions into, and knowing what's valuable to them and framing your message and your action around that valuable metric content, and endpoint that's of interest to them. And I think tapping into who might already be in this community that's doing something that, again, we could fold in heat as part of that. I think extension is a fantastic example of many different ways that's been done for the agricultural community. But, if it's seniors in rural New York, in Lewis County, who all get Meals on Wheels, is there a way to partner with that organization in particular, that they're getting food and nutrition information, but also maybe information about hydration as well to protect themselves in heat? So I think, yeah, figuring out that audience, that target population, what matters to them, and who is already a trusted and integrated partner in that space can be really key.
And I think along those lines, I think both many of the presentations talked about the role of community and, brought up community organizations. I mean, beyond cooperative extension, do you have ideas or different types of community organizations that we should reach out in particular to? And I imagine that they would perhaps be somewhat different in some ways between upstate and, in the city or in, urban areas. But do you have any ideas on like ways government or way community organizations might organize around, this issue of heat in the future?
I can say that, I mean, in New York City, We Act for Environmental Justice has been a really critical partner in this work and raising awareness, and also in advocating for various interventions, and working with academic partners, but also working with the city government. Our project, for instance, was a reflection of that kind of collaborative work. And I think, this is an issue that kind of touches multiple sectors. And I think really kind of having multi-sectoral conversations is really critical, and not necessarily making this about the environmental justice groups or the kind of healthcare providers, or social service agencies. Really, this is about kind of inviting those conversations to happen collectively, so that we can learn from each other, and that, like whatever information is necessary on one end is provided, so that the programmatic or the policy components can be realized. But I would say that, this is an issue just like everybody eats and needs food. I feel like, a lot of these kind of thermal comfort issues, access to cooling, questions around energy affordability, a lot of these things are really very common, and I think cross-cutting, and there are touch points across many different groups that are sometimes not invited to discuss this. And so I think really it's about creating those spaces. I mean, this is a good forum for that, but there are many others that can happen also.
I didn't know if Dr. Aller or Dr. Williams, if you had anything you wanted to add.
Yeah, I think just briefly, I feel like, I was away from New York State for a few years, so I feel like I've been kind of figuring this out myself, in the last few months since being back, of getting a handle on who's in the space. And I think what Dr. Hernandez just said, of like, seeing what are these cross-cutting things that no matter if you tie them to climate change or not, that matter to people, and have initiatives and programs in place to tap into is really key. And I think, to some extent that might require a little bit of, innovative thinking, or thinking a bit outside of the box of, if it's farm employees that you're trying to target, just thinking of all the different groups that those folks may be engaging with. I know, just as kind of an anecdotal example, people are going in, buying and having their tractor serviced. Can you partner with that type of organization that they're encountering on a very regular basis to just kind of casually talk about some things, or provide educational materials? Can you partner with the cooperative that's selling the seed and the fertilizer or other products that farm employees need to provide some of this information, or lists of services that might be available to them in the state that maybe they didn't recognize or realize might be available for this particular issue. So I think, again, figuring out who might be all the players, and are there new ways to tap into those spheres to talk about this and share this information.
Yeah, and I guess I'll add, just to the great points from Dr. Hernandez and Dr. Williams, are, I mean, from in the agricultural space, I think and know the partners like the USDA, NRCS, Soil and Water Conservation Districts, but I think in other areas as well, thinking about land trusts are important, and other local environmental organizations. And I also think starting at the youth level, and bringing in maybe schools or 4-H programs, or youth groups into the conversation, start educating about them about heat and some of these impacts. Or, if they're running around at camp, are they getting hot, and are they feeling hotter than yesterday, or whatever it may be. I just think having that conversation with the younger population is really important. And I think the last thing I'd add to this as well, from a communication perspective, and a conversation we're really having in, I'd say, the agricultural space, is making sure education or documents are available in different languages. I know translating a lot of materials into Spanish is a big thing among the farm worker community in New York State. And so that's something, thinking about how can we create programs and make people aware of some of these really important issues in a way that they understand it, and in their native language.
I think that's very, very true. I mean, just here in Buffalo alone, one of our high schools, I think, has 26 spoken languages. So just getting the message out about heat in that community in particular is really challenging, to make sure you're meeting people where they are, and making sure that they understand, what something like El Nino, or just climate change in general, is potentially going to bring to a place like Western New York. There were some comments and different things that were in the chat that were sort of related. We are kind of running out of time here, so we will try to capture the comments that are in the chat and incorporate that into our planning process as we're moving forward. But I do want to just thank the 3 speakers today for 3 really fantastic presentations. It lived up to the title in terms of crossing many different landscapes of New York State, so very grateful for the time you spent today. Certainly, I feel like I learned a ton from each of your 3 presentations. Our next panel presentation is scheduled on June 8th from 2 to 4 p.m., and it's titled Showcasing Local Solutions and Partnerships. And so I think it'll pick up on some of the things that we just talked about in terms of engaging local communities. It's going to showcase local solutions from different communities across New York State and the people who are behind those solutions. And it will be a tangible and positive change that have been advanced by partnerships among community organizations, local governments in the state of New York. And on the summer solstice on June 22nd, we're going to have our final webinar in the series called Preparing for Summer 2023. So perhaps incorporating some of the ideas about El Nino, what individuals and local governments can do during a heat wave. And so this webinar will highlight concrete approaches for staying cool and safe during heat waves. And it's going to describe individual measures to cool one's home, the various ways in which local governments, emergency response coordinators, and community groups can come together to help their communities be safe, and the resources that are available from the state of New York to support local preparedness and adaptation. But again, I just want to thank each of the three of you for giving a fantastic presentation today. I think this is going to be a great resource that lives on the DEC website, and hopefully will really help us as we all try to prepare for a hot summer coming up, but also just for more climate change in general. So thank you very much.
Thank you, everyone.
Bye, thank you.
That concludes today's webinar. Thank you very much for everyone for attending.